So convalescent plasma donation is a process where we take the plasma from people who have recovered from a COVID-19 infection to be used as a medication in the future. Plasma is the component of blood minus the cells, so it's just the liquid component of blood, everything that you would normally have in blood, minus the cells. And that plasma in people who have recovered from a COVID-19 infection contains usually high numbers of antibodies, which are a protein that is produced by the immune system that can help fight off viral infections. So what we are attempting to do through the Convalescent Plasma Project is to bring those individuals in, collect their plasma, and then that high level of antibodies that their immune system has developed will be the actionable element when that's used as a medication for somebody else. So we're collecting plasma from individuals who have recovered from COVID-19 with the expectation that the plasma can actually be used as a therapeutic to treat other individuals who have severe COVID-19 infections. So it's almost like a medicine that we're collecting and making in our own blood donor centers so that we can turn around and use that in the hospital for future individuals who have very severe COVID-19 infections. If you are fully recovered from a coronavirus infection, yes, you are eligible to donate plasma. There are some other restrictions that go into donating convalescent plasma, most of which have to do with all of the other things that we normally ask to make sure that somebody is an acceptable blood donor. But yes, the first requirement to be a convalescent plasma donor is to have a documented positive result for a COVID-19 infection, and then to have been recovered. And right now, the recovery period that we want to see is 14 days since your last symptom. From my perspective as a medical director of the blood bank, the biggest thing that people who haven't had COVID-19 can do is to come and donate blood products. So COVID-19 is certainly very serious, and it's kind of occupying a lot of our time here in the hospital. But even though the COVID-19 pandemic is ongoing, there are still patients who have cancer. There are still women who are delivering babies. There are still patients who need surgery, and a high proportion of those patients still need the life-saving support from blood products. But it's still incredibly important for us to be able to support our other patients in the hospital to have those blood products. And we're instituting all sorts of measures at donor centers around the country to ensure that the donation process is absolutely safe and that people are taken care of, and we want to do that to ensure that individuals know that when they come out to donate those needed blood products, that we're taking their safety very seriously. What really makes us different is that the Armed Services Blood Program is the sole supply of blood products for all military treatment facilities in the United States and around the world, and we also help to supplement the blood product supplies of Veterans Affairs facilities around the country as well. So I would say the biggest thing that makes us unique is that if you donate at an Armed Services Blood Program facility, your donation is going to support either a service member, a familial beneficiary, or a retired service member in this country or somewhere around the world, and that's, from our perspective, a very good thing, and something that requires a willingness that we're so thankful for on the part of our donors to continue donating at our Armed Services Blood Program facilities around the country. So if you are near a military base, just a simple check on the Armed Service Blood Program website will allow you to know if there's an Armed Services Blood Program facility in your area, and donations at those facilities go to support the United States military all around the world, and we're extremely thankful for your donations.